Hello, beautiful women out there, and welcome back to the Menopause Revolution podcast. I'm Leah Kapral, certified nutritionist, scientist, and holistic menopause coach. I'm so happy to be with you, so welcome. Today, I'm thrilled to welcome Dr. Jasmine Jamora, a certified dermatologist based in the Philippines and also the founder of Jamora Skin Clinic. Dr. Jamora brings an incredible depth of expertise to the table. She trained in the United States, is an integrative dermatologist, and she currently serves as a consultant at the Makati Medical Center in the Philippines. She's also actively involved in dermatological, bit of a tongue twister, societies and other skincare foundations across the Philippines. What really stands out about Dr. Jamora is her compassionate and holistic approach to skincare. She recognises how nutrition, lifestyle and supplements play a powerful role in supporting healthy skin and healthy hair. What are common skin conditions women experience midlife?
Hi, Leah. Yeah, absolutely. Women can experience a lot of skin problems in midlife, whether it's in the perimenopausal age or in the menopausal age. So we know that in menopause, you have 12 months straight of no period. And this is a period in which your hormone levels really decline, especially estrogen or estradiol, which is a master hormone. And so we start to experience things like dry skin. The hair can start to thin. And for me personally, one of the first signs was itching, especially in the vulvar area. So vulvovaginal dryness is a big problem, especially as everything in that area, like the skin, starts to get thin. So our skin starts to get thin from the first layer, the epidermis, and even the second layer, the dermis, which is composed of collagen and elastic fiber. So that starts to thin as well. And the hair starts to thin naturally with age. So dry skin, thin hair, this vulvovaginal itching. Women can also take a little bit longer to heal because of the collagen issues, and they can start to see changes of aging. So you'll start to see more wrinkles, a little bit more sagging. So those are the common skin findings that we see. Easy bruising can also be a problem.
Okay. And what about actual skin conditions? Is there something that you see that would flare up midlife that maybe it was a little bit hidden or not as intrusive before experiencing a change in hormone levels? Is there things that all of a sudden kind of become, quite
Sure.
critical?
So you know that estrogen is one of the main hormones that allows us to deal with stress better. So when when the estrogen levels drop, the ability to manage stress becomes a little bit less. And so the skin conditions that are connected to stress, like seborrheic dermatitis or dandruff, can be there. Psoriasis can flare, especially with stress. Things like urticaria or hives can come up. Um, Atopic dermatitis or skin asthma or eczema can also get worse if the stress becomes unmanageable. Also, with things like lack of sleep, which, as you know, can be part of menopausal symptoms, these things can really flare up as well.
Okay, and I've seen clients that their psoriasis has pretty much disappeared on my program, and another one that I've seen clients when they start is rosacea as well. Is that something that you see commonly midlife that maybe it was something that just was a bit blended before, but now it's starting to really, be more prominent? Do you see cases around that as well?
Yes,
Yeah.
absolutely. So it depends on the skin type, Leah. So in Asians, we don't have as much rosacea. We do see it in the
Okay.
Chinese, ethnically Chinese subpopulation. But in the darker skin types, it's not as visible. But in the lighter skin types and in Caucasians and the Chinese ethnic descent ones, you will see that flushing and blushing, which is persistent, which is what we call erythromelalgectatic rosacea. the kind of broken blood vessels, and then you can also see them start to get kind of this acneiform eruption, pustules, okay, which are the white pussy areas, and sometimes some of these women can also have Demodex mites uh, on top of the rosacea, so we do see that as well. And so there, especially with the flushing of menopause, okay, the hot flashes, you can get worsening of the erythema and flushing and blushing of rosacea. So the redness, the broken blood vessels, the papules and the pustules can be there. And you can also start to develop the early signs of late stage rosacea, which are the thickening of the forehead, the nose, and the chin, which is the nathophyma, the mentophyma, and the rhinophyma.
Okay, so are you saying that with rosacea that will actually thicken over time? Is that
So it depends. Some people will progress from the flushing, blushing, or the erythematolactic over to the papulopustular rosacea, which is kind of the second stage, and then the third stage, which is the more chronic one, where you get the thickening of the skin. It can happen in a progression. For some people, they will just stay flushy, blushy the whole time, and for some people, especially men, they start to get this kind of the thickening already of the nose and the chin as an expression of their rosacea, the kind of thickening of the sebaceous glands.
interesting? Would you get it on your forehead at all? Is that
Yes,
something,
absolutely.
another location?
We call it nathophyma. Here would be the rhinophyma, and then here would be the mentophyma. So either of these kind of T-zone oily areas is where the sebaceous glands can thicken, for sure.
No, I'm just asking that because I have rosacea.
Is it okay?
And yeah, and it's not chronic or something that's really bothers me, but I have noticed I'm getting the thickening of just a couple of little, I don't know if they're pores that have gotten thickened.
They might be just oil glands, Leah,
Yeah.
just sebaceous
Okay.
glands. Yeah. So there's a lot of things we can do for rosacea. The nice thing about treating rosacea in menopausal women is you don't have that reproductive issue because isotretinoin, which is a vitamin A tablet, which is teratogenic and kind of difficult to give to reproductive age women, because if they get pregnant on it, the baby can be deformed, right? It's teratogenic. So once they're menopausal, then it becomes kind of easy. You can give longer periods of time for isotretinoin. It's a very good to control the breakouts, the papules and pustules, and it can actually hold back on the phymatous changes because it helps to shrink the oil glands permanently. So it's a really good medication to give. It's an
I
oral
didn't know.
tablet.
Okay. I didn't know that was possible. So thanks for that. And
Sure.
just knowing that, yeah, I guess midlife, as you said, with the decrease in estrogen, and then just there being a lot more inflammation present in the body, that can cause and trigger different skin conditions and impact your skin health. That's what I heard.
Absolutely.
Yeah,
Absolutely. So I think
awesome.
one of the most important things for women in midlife is just there's a lot of basic care that you can do. So just using a kind of a mild cleanser, I would stay away from these kind of beaded exfoliant types because the skin is just getting thinner and more sensitive. So just a mild cleanser, not too much fragrance, and of course sunscreen is very important in the morning. So an SPF of 50, 50 and above is very important just to avoid kind of pigment problems because once you get into menopause, the melasma or the pigmentation problems can start to be triggered. So you can start to get these lots of freckles and a lot of kind of this patchy pigmentation on the face with hormonal changes. So the very mild cleanser, the SPF 50 sunscreens in the morning. Try to stay away from makeup that is very highly fragranced because that can also trigger pigmentation. I would also suggest moisturizers that are really mild, especially if you tend to be dry. Just a very mild kind of bland moisturizer. There's a bunch of stuff on the market that you can get that doesn't have a lot of fragrance, that is hypoallergenic and fragrance free that you can use. Uh, After you take a shower, immediately after you take a shower, your skin is still kind of wet. Within 2 minutes, you want to trap in that moisture with a moisturizer. It'll really help to keep your skin kind of healthy because with menopause and the estrogen drop, even the water loss in the skin can be quite significant. So you can get drier faster, especially during the dry season. It's becoming winter in many areas, so the skin is quite dry, the humidity levels are lower, and so all the more moisturizers become important. Yep.
Mm. Okay, great. That's some great basic tips there for women out there to consider now that they're midlife. Like what I heard was, yeah, just being a bit more sensitive around your skin in the products you buy, and then, yeah, just trapping in that moisture as much as you can. Yeah, no, that's great. And I just wanted to ask just around alcohol and caffeine and other, I guess, little treats we might have. During menopause, do you see that people who might drink or drink a lot of coffee or other lifestyle factors, do you see that their skin conditions are worse, or is there any difference there just in terms of management and what we can practice and
Sure.
how we can look
Sure. Let's
after
start
our
off with
skin?
Sure, let's start off with caffeine. So, as a person with rosacea, that caffeine is quite difficult to take. If you have baseline rosacea, there's a rosacea diet that includes no cinnamon, no tomatoes, no caffeine. So this means either in caffeinated black teas or in coffee, and no hot drinks or spicy foods. So then, if you like coffee, then you can take like a cup or so, but try to get it iced or cooler. So you have to cool off the hot food because it tends to cause the blushing and the flushing of the face. So limit your caffeine intake. Try to drink herbal teas or decaffeinated coffee instead. And for
Mm.
Coke, again, it's kind of decaf would be better, or decaffeinated drinks would be better for rosacea. But for menopause in general, there's really not much limit. I think the caffeine intake would be dictated by the maybe cardiac issues that you may have. Some people get a lot of palpitations if they're drinking more than 2, 3 cups a day. So I would just monitor that for caffeine.
Mm.
Now for alcohol, Leah, you know that alcohol is toxic to the gut, right? So
Yeah.
any alcohol intake is just completely toxic. So for rosacea patients, completely no alcohol. Okay. And for patients, especially who have skin conditions at baseline, like maybe atopic dermatitis and even psoriasis, it's completely taboo. I tell them to get off alcohol. It's very toxic to the gut. It just causes a leaky gut. Once your gut starts to open up and all the toxins come in, it starts to trigger the inflammatory cascade in your skin, and then you'll see kind of flares of psoriasis, atopic dermatitis, rosacea. And especially if you have gut dysbiosis, if you have rosacea and you have some gut issues, like you get bloated, you get kind of acidic, you have a lot of gut pain, I would stay away from alcohol, and I would be careful about your microbiome because even in
Mm.
menopause, you can have issues with the gut microbiome. So the gut and the skin microbiome become less diverse, which is why we have to be more intentional about eating well to support a healthy gut microbiome. So this would be eating a lot of vegetables. You can take a lot of like 5 to 6 per meal, different colors of vegetables, a lot of high fiber, and also for the skin microbiome, you can use kind of lotions with prebiotics, like a lot of oat or allium sativa, a lot of oligosaccharides. So some moisturizers now have what they call prebiotics or actives that you can use just to support that skin microbiome as well.
Okay, so are you saying that there's prebiotics that have some ingredients in them to support the skin? Is that what?
Yeah, yeah, there are some. I mean, one example, Leah, that's pretty common is moisturizer with oats. So oats
Okay.
and its breakdown products is considered prebiotic for the skin microbiome. So just using that kind of lotion or moisturizer can support skin microbiome. Now, for the gut
Right.
microbiome, you would actually take a lot more
Yeah.
fiber. And in menopause, you would like to stick to phytoestrogens, okay, some soy, even though I know people have issues with soy, and carcinogens. Some people don't like to take a lot of soy. You can take papaya. resveratrol. So if you do want to take alcohol, try to take the red wine, which has a lot of resveratrol, grapes as well, grapeseed derivatives. So those things, legumes and beans are very good to support the gut and the microbiome in midlife and menopause.
Okay. Yeah. Yeah. No, I got that there's two. There's like the skin microbiome you're talking about and feeding
Yep.
that with oats
Hmm.
and high fiber foods, which
Hmm.
makes sense because
Right.
that's what your gut
Hmm.
microbiome loves too, that high fiber diet. And as you said, like the leaky gut and your microbiome become less diverse
Yeah, you might be surprised, Leah.
with
Aside
drop-off.
from topical medicaments now that has prebiotics and oligosaccharides and the oats, there are actually some topical creams that have probiotics in them, but very few. But you can find those on the market as well. So you can look
Okay.
for both if you're looking kind of for more, kind of step up support for your skin microbiome.
Okay. Great. Another area to explore. Thanks for that. So the next question I've got is, so I guess the treatment for each condition is going to be specific. You mentioned some general practices we can take on just generally to look after our skin midlife. Um, is there any practices that worsen your skin? Like you mentioned, quite like just exfoliants, just be careful of how rough they are now. Is there anything else that we should like stop doing with the perfumes and things like that you mentioned, but anything else that's there that could
Yeah,
worsen our skin condition?
sure, absolutely. So some people tend to take very long hot showers. So what we don't know is that a long shower and a hot shower are quite detrimental, especially if you're prone to dry skin. So I do
Mm,
suggest a lukewarm shower, about 5 to 10 minutes only. Don't scrub your skin. Use a really mild soap, like a baby soap or just something that's hypoallergenic or moisturizing. And then as soon as you step out of the shower, kind of pat dry, and then you apply that lotion within 2 minutes. And that's a way for us to really keep our skin healthy, okay, especially in the wintertime. So I don't suggest a long hot shower. I suggest a 5 to 10 minute, maybe lukewarm water shower, especially in the wintertime. So that's what I do recommend. And I do see a lot of issues. In the Philippines, we love to take multiple long hot showers, maybe 2, 3 times a day and kind of scrub our skin out and then that's when we start to see some issues, some dry skin, steatotic eczema, or what we call winter itch, which is funny because we have a very tropical climate here, but because of this kind of excessive overbathing or using really kind of harsh loofahs or pumice stones, we can see a lot of
mm,
eczemas arising from that, especially if people have inherited kind of dry skin or have this eczema background. Mhm. Yep. And for people who are
yes.
prone to pigment, yeah, for people who are prone to pigmentation, as you mentioned, especially melasma, we do want to stay away from fragrant shampoos, soaps, and even just perfumes. So if you love perfume but you're prone to pigmentation, I would suggest that you hang your clothes in the closet, have somebody spray it with your perfume, and then you kind of wear it. So you don't spray it on your skin.
Uh,
Or you can use one of these perfumed lotions that you can put on your arms and then wash your hands and then put sunscreen on, because the
mm,
combination of perfume and the sun can be quite detrimental, especially if you have a little bit of a color, more color in your skin. Like if you have a little bit of brown skin type, it can be detrimental for that. And interestingly, for women who love to cook, that heat on the face, it's called infrared heat, can be quite detrimental as well, especially if you have pigmentation problems. So one thing women who love to cook do if they have pigmentation problems on the face is after you cook, get kind of a bowl of ice water and just kind of splash it on your face, get that heat out, and that can really help kind of prevent pigment problems from worsening.
yeah, as you were sharing, I guess the impacts of heat. I was thinking about like the fascination about ice bathing and saunas and spa baths, like that all would
Right.
impact on our skin health. And even
Sure.
the microbiome on our skin probably dies off with those extreme temperatures as well. So, yeah, it's
Yeah,
given me food for
especially if you
thought.
have rosacea. That
Yeah.
heat can really be detrimental. So if you have rosacea or pigment problems, I would stay away from kind of saunas and steam baths, even though they're lovely. Generally,
Mm.
they're very good for your health and for your skin health in limited amounts. But if you do have those baseline skin problems, it can kind of trigger it. So just be mindful.
Yeah. Okay. Thanks for that. So I read on your profile and in your business that you also do a I'm going to say it wrong.
Sure,
Intri-
integrative, yeah.
integrity,
Integrative, yeah. Dermatology.
yeah, dermatology. And you shared about how nutrition and supplements can support healthy skin, and I'm thinking hair as well, and nails. Can you share a little bit around what you, I guess, teach your clients, and what supplements you would, I guess, recommend around certain conditions?
Sure, absolutely. Let's start with hair. So, as we age, we find that our hair becomes thin naturally, unless you have a mother or father who have really thin hair, in which you can have what they call female pattern or male pattern baldness or alopecia. So, for women, you would see kind of the top of your skull kind of getting more visible, and that part kind of getting wider for women. And for men,
Yeah.
the typical pattern would be the recession of the hairline up here, and they would kind of lose a patch of hair here. Now, for patients like that, we need to be a bit more active about treating it, maybe with minoxidil over the counter for men twice a day, for women once a day. And there are also supplements for men. You have to talk to your board certified dermatologist about these supplements. They're not really supplements, they're medications. For women, there can be supplementation like saw palmetto if you're not reproductive age. Again, if you're menopausal, these are a little bit safer. Saw palmetto supplements, and also even what we give men like finasteride and dutasteride. But you please have to talk to your board certified dermatologist about these things before you start taking them. There are supplements in the market with saw palmetto and ashwagandha, which you can take. Um, Biotin is very popular for skin, for hair and nails. But the thing with biotin is you have to be deficient for it to work. So you would have to check your biotin levels at a lab. And if you're deficient, then you can take the supplements and it can help. But if you just want to supplement your hair and nails, just like that, without checking your biotin, then be careful about taking too much biotin because it can mess with your thyroid hormones. So you have to, again, speak to a board certified dermatologist about that. So that's for hair. Okay. So for hair, just use a mild shampoo. Don't be too aggressive with the blow drying, with the straightening and the brushing. If you're starting to lose your hair, use a wide tooth comb. You can use over the counter minoxidil. Ask your pharmacist also for guidance. But I would suggest for women just once a day, either 2 to 5% minoxidil. You'll start to see results in 5 to 6 months. You may see an initial stage of shedding. Okay, if you're starting to lose your hair, count it on the days that you don't shampoo. So what you can do is for 2 weeks, shampoo every other day, and on the days that you don't shampoo, you count the number of hairs. And if it exceeds 100 to 150, then you have a problem. Then you need to see your board certified dermatologist. Okay. Um, so for the Philippines, it's pds.org.ph. But yeah, see your primary care physician or your dermatologist for that. Now, if it's just regular hair thinning, then that's fine. Now let's go on to the skin. Supplements for the skin. One of the most important supplements, I think, just for overall health is vitamin D. Letter D as in dog, especially D3 or cholecalciferol. You can take a regular supplement without checking your levels if you're just fine, 800 to 1,000 a day. But if you are having severe skin problems, I would check your vitamin D3 levels. Oftentimes, for patients with uncontrolled psoriasis or atopic dermatitis or even acne, we see severe deficiencies. Okay, so we're aiming for a number like between 80 to 100. A lot of them are in the 10s to 20s. They don't know, they feel fine, but they're inflammatory, their immune system is kind of out of whack. And so what we do is we have to actively correct these patients. So again, if you think that you're having a vitamin D issue, then check your levels. If not, a regular vitamin D supplement. If you're taking it with your calcium, then it's fine. Calcium and vitamin D3 is a good supplement to take. Other supplements that you can take in general, are just antioxidants, vitamin C, vitamin E if you need it, and vitamin B3 is a good supplement. You can also get this topically as well. So you can get topicals with vitamin C, E, and ferulic acid. These are nice topicals that you can put on your skin in the morning, and then your sunscreen after that. And at night, I would recommend a vitamin A topical supplement like a retinoid. So over the counter, you can find retinol, which is very good. You can just use that. It's found in many good brands. They usually call them night or rejuvenating creams. If you're getting it from your dermatologist, you might get it as a tretinoin, trifarotene, or adapalene, or even tazarotene. So these need to be managed by your dermatologist. But the over-the-counter retinol is generally fine if you don't have any skin issues, if you're not getting itchy for that. So that's for the topical supplements. I hope I answered
Okay.
your question, Leah. Yeah.
Yeah, that's a whole suite of supplements there. Yeah, and yeah, just checking your bloods first to see if you're deficient in that, and yeah, how you
Biotin
can
and D3.
support.
Yeah.
Yeah, for sure. So thanks for that.
You're
So
welcome.
just the last question is what kind of help is available for ongoing concerns, and how do women access someone like you?
Yeah, I understand the healthcare systems in different countries can be quite variable. So for countries that have the national healthcare system, you would need to go through a primary doctor first. And in general, our primary care physicians are very well trained. If you just have like common skin conditions, they would be able to diagnose and manage those. But if you do need to see a dermatologist, then you can ask your primary care physician to refer you. It might take a month or so. In the Philippines, it's kind of out of pocket. So if you want to see me, like I'm here at the general hospital today, so I see charity patients here. They kind of walk in as well, but they don't really pay much out of pocket. The government pays for it, but it can be a long waiting time. I also have a private clinic in which people can just come contact me, schedule a teleconsultation or a face-to-face consultation, but they pay out of pocket. It's a bit more expensive that way. But yeah, I think you can access your dermatologist in several ways. I do suggest that if you find that you've seen two or three doctors, things are not going well, I think you should see a board certified dermatologist in your area. Go to the websites of your of your countries and look for board certified dermatologists, and then you can find either MDs or DOs who are board certified and can help you with your issues. If you feel that you're having a complex medical problem, you might want to see a specialist, okay, either an advanced medical dermatology specialist. You can see if you have psoriasis, you can see a phototherapist or an immunodermatologist if you have blistering disease. And then there are doctors who will check your whole body, which are the functional and integrative doctors. So there are doctors who have taken the functional medicine course from IFM that are either practitioners or certified. And then there are the more integrative dermatologists like myself. We don't do as much labs, but then we can kind of take you through a more holistic approach to your scare. We'll talk about your sleep. We'll talk about your stress levels. We can teach you some breathing exercises, how to manage your stress better, and also we'll talk to you about your diet and things like exercise. So it's a little bit more holistic that way. Thank you.
Yeah. Yeah, and that's why I invited you on is because of your holistic approach. And yeah, so thank you so much for sharing yourself. I know that you're really committed in this area of work. And yeah, I fell in love with you the first time I met you.
It's a pleasure, Leah. I'm
Yeah,
so
so
blessed. I
thank
mean,
you so
it's
much.
such a pleasure for me to be able to help. And yeah, you can reach me on my website. I mean, if you want to just drop me an email, you can get me at drjasminejamora@gmail.com. I'd be happy to help you if I can. I can do a teleconsult if you need, but it's kind of hard for me to prescribe outside of the Philippines.
Mm,
But yeah, if
yeah.
you just want to drop me a line, I can do that. I can answer a question for you if that's what you need. I also want to say, Leah, that, for women who are dealing with menopause, before we end, you should see your obstetrician, your gynecologist, your primary care physician, or your dermatologist if you feel that you need supplements, right? So there are what they call bioidentical hormones available on the market that are safe, that don't carry the carcinogenic risks of regular hormone replacement therapy, that you can do either topically, kind of this balance of topical estrogens and progesterones, that a board certified professional, either a functional integrative doctor, OB/GYN, dermatologist, primary care physician, find the doctor that you need, that can help you through these issues, because it's not easy. I mean, I am like you, I'm at that age, and so it can be quite difficult. And there are things that are happening in our bodies that can make us wonder, like, what is happening to me? But when we realize that a lot of it is hormonal, and you have somebody to walk with you in that journey, I think it'll make it that much better. Thank you.
Yeah, for sure. Yeah, part of putting the podcast together is that we really need a team. If we've had good health up till now, or a minor condition, now we actually need a team to support us to live, live well. So
And
that's what I
don't
hear.
feel ashamed to ask for help, right? For surely. Like a lot of times we feel like we need to like plow through it by ourselves. Like, I can do this. I can just like willpower myself through menopause. But yeah, you're right. It does take a team
Yeah, yeah.
for sure.
So thank you so much for being with us.
You're welcome. It's my great pleasure. It's my pleasure. Thank you for inviting me, Leah.
Thank you for the conversation. Thanks for joining me on the Menopause Revolution podcast. Remember, you don't have to do this alone. If you're ready to discover what your body's really saying, download the free Midlife Symptom checklist on my website by going to www.themenopauserevolution.com.au or see the show notes below.